Hi, today's COVID-19 bulletin is a vaccine update. Christmas has come a few weeks early for UK citizens. It has become the first country in the world to give emergency approval to US pharma giant Pfizer's vaccine. It will be made available across the country starting next week. The US will decide on emergency approval for Pfizer's vaccine on December 10th. If it's a yes, then the first doses will be made in the States by December 15th. The US is also looking at Moderna's vaccine, which has also applied for emergency approval. If that's a yes, then Moderna's doses will be ready for distribution in the country by December 22nd. Just to recap, Pfizer and Moderna's vaccine candidates have thrown up a high efficacy of over 90%. But Indians have little to cheer about. The vaccine, Pfizer's vaccine, requires extreme sub-zero temperatures for storage and transportation, a logistical capability India and many other parts of the world, including the United States, don't have. Our best bet is Oxford University's vaccine, which has been mired in controversy for the last few days. They announced an average efficacy of 70% based on trials done in two different groups and two different dosages. One group got 1.5 doses of the shot, and that threw up an efficacy of 90%. The other group got a dosage, 2 full doses, and they threw up an efficacy of 62%. You may have also heard recently a Chennai-based volunteer in phase 3 trials of the vaccine claimed that he suffered from serious side effects after getting the shot. This happened in October. SII did not go public, neither did it stop the trials. Yesterday, in a press conference, when the head of ICMR, the government's top medical research body, was asked about the trials, he said that after an initial assessment, they don't feel the need to stop the trials still. Meanwhile, other volunteers in SII's trials told Times of India that they feel betrayed. SII never informed them either of the serious adverse event. And now the latest. SII has said that it will not be altering its trials to include the 1.5 dose combination, which was 90% effective, because that will delay the trials. It will continue to test the 2 full dose regimen. This means that trials in India are on the regimen with an efficacy of 62%, and that's the vaccine we will get if all goes well. We'll know more in 2 weeks when SII plans to apply for approval. Before we end, there's a statement by the Union Health Secretary that I want to flag. Yesterday, when he was asked by when all of India could be vaccinated, he said, "I want to make it very clear that the government never said that the whole country will be vaccinated." The ICMR clarified that it is possible that the government only vaccinates enough people so as to reach herd immunity, which is when enough people are immune to the disease and transmission effectively stops. A fact check is critical here. In the last week of October, in an interview with Economic Times, Prime Minister Narendra Modi said, and I quote, "I would like to assure the nation that as and when a vaccine becomes available, everyone will be vaccinated. No one will be left behind." That stands on its own, so I'll leave it at that. My name is Pallavi Prasad, and this is NewsWorthy. If you find value in this bulletin, do share, leave us a comment, and subscribe or follow us.